Good morning, Facing Body. So, as you can see, bow ties back on. I am at work. I do need to see some essential patients today on my schedule. Schedule is pretty light, but I'm also going to be attending a conference webinar with Allergan, which is going to be very helpful in terms of overall small business management. So, what have been my challenges today? And how are you guys surviving? We're all in the same boat. We're all mentally just going up, down, and all around. My challenges, what did we do for fun? We did some learning, distance learning with the kids. My wife, my beautiful wife, is taking care of all of that, and she has been, bless her soul, handling that aspect of the whole 4 kids of ours. That's been a little crazy. And we fixed a dishwasher, so I'm trying to keep my hands going. So that's been exciting. So we are all in this together. Still need to get a haircut, so we're all trying to figure this out. But I do want to give a little bit of an update on kind of where we are in the overall situation, because there's a couple things I want to pass on as a message, which is I don't follow the news at all. I believe the media is completely tainted. The fact of the matter is, no one knows how many viral cases there are of COVID-19. No one. We did not. 2 failures were, number 1, we did not have testing. And number 2, no one is listening to social distancing. That is a problem. And here is why. The fact of the matter is, there are 3 areas that we really need to look at. Okay, the overall picture is this. We need to look at, number 1, the healthcare system. Are we prepared and are we ready for a potential overload of cases? If we look at Italy and now New York, which is completely getting inundated with this spread of transmission, and again, it's silent transmission, and that's what no one is respecting about the intelligence of this virus. Our healthcare system is potentially going to be overloaded. Again, look at the cases in Italy. If it comes to the point where, again, looking at statistics, if we say 80% are asymptomatic, that could be anybody walking around and they're touching everything and passing it on to everyone, then the other 20% who get sick need to go to the hospital. And then you look at the 5% of the critically ill that are going to need ICU beds. And that's where the problem is. So that's where, if social isolation doesn't work and we continue to spread the disease, we are going to have critically ill patients that are going to overload the ICU beds. My particular hospital has about 36 ICU beds. We're prepared to convert the OR to another 10 to 12 ICU beds. Okay? Now, again, we are on the other side of the healthcare system is nationally we are low on what are called PPE. What is PPE? PPE stands for personal protective equipment. Okay? And so those are the masks, the N95 masks, gowns, etc. A lot of hospitals, and you can see even in the news, have probably about 10 to 14 days left of PPE gear to protect our healthcare workers. What does that mean when we run out? That means all the hospital workers are going to potentially be contagious as they get transmitted the disease, and the hospitals are becoming hotspots. Again, look at Italy and look at what their physicians are doing. They're running into this exact problem. So this isn't about, hey, this is just a flu, it's going to pass. Yes, it's just a flu and it shall pass. But what are the effects? Number 1, think about the healthcare system. And I think that's the point a lot of people are missing. My information is coming specifically on the real front lines. I'm in talks with my pulmonary critical care physician colleague in the ICU. He's telling me the real deal and treating COVID patients. It is also from, I have a COVID chat forum, which is full of doctors across the nation. And what are they seeing? Anesthesiologists are in extreme high exposure as they're intubating potentially contagious patients. And I know of an anesthesia group that 3 to 4 of their partners are already contagious and are very sick. So this is a very real thing that you may not be seeing out in the streets, out and about. But going back to that initial message, if we don't socially distance, this virus is being spread like wildfire, silently, and that's the potential real big problem here. The second issue at hand is the economy. We are all in the same boat. I mean, I had to let go of my poor wife because we are potentially shut down in the med spa. I do advise, if you don't have a job, of course you're going to file for EDD, unemployment, okay? And that's very important. You do want to seek out any governmental assistance. If the government stimulus bill passes, it has passed the Senate, and they are discussing it in the House today. That will be a huge assistance to small businesses, everyone from myself to retail stores to restaurants. Everyone can benefit. The economy obviously is in a huge state of trouble, but we are all in this in the same boat. I also recommend that you do call your mortgage company to see what they offer in terms of deferments. Most mortgage companies are allowing a 90-day deferral. We can all use this assistance. Don't miss a payment, but have that communication with your bank. So those are the two important factors that we are teetering. It is what is going to happen with our healthcare system. Is it going to be overloaded? And what's going to happen with our economy? I'll be continuing to give you real life numbers and updates just from what I am hearing from my local community. But I am in talks with physicians, and we expect peak wave of COVID to be in about 1 to 2 weeks. We haven't even come close to the peak. So we do need to be prepared in that sense. And the only thing you can do is please isolate yourself from just the community. It is the safest thing you can do. I hope you have a blessed day. I'm going to go see some patients and get back to work. And we will get through this together, and we will certainly be able to conquer this, but we do need to listen and be smart and intelligent about the global perspective. Have a beautiful day. Stay mentally active and stay physically active. Very important to do that, and give yourself a break on these routines. It's really nice to do that. Prayers to you all, and we will chat soon.